Hi family, I'm Dr. Brenda Awoburiasti. I'm a licensed daycare provider, a published author of 3 children's books, an advocate, a consultant, a veteran's wife, and a mother. If you need help setting up your daycare service or just looking for great ideas to incorporate a play-based learning approach as well as learn about research-based solutions to issues impacting education, this is the channel for you. Subscribe, share, like. Thank you. This is gonna be updated Virginia Department of Education safety protocol for on-site inspections. Now it was dated July 29th, 2022. And if you're an in-home daycare or a daycare center, this is very important information for you. It is from Jeffrey S. Williams, Director, Office of Childcare, Health and Safety. And this is just an email that I received. And this came just in time because I just had a licensing visit. So this came just in time. The Virginia Department of Education, Office of Childcare, Health and Safety, OCCHS, is committed to the health and safety of children, educators, providers, and our staff. So this memo provides updated information on the safety measures Vdoe has implemented for staff conducting on-site inspections and supersedes the memo to Child Day programs issued on April 5th, 2022. If you're an in-home daycare or a center, you know we always have on-site inspections. Some are annual, some are just because somebody reported you anonymously and the state wants to come and make sure everything is good, and some are just on schedule. They just show up whenever they like. So safety protocol for on-site inspections. So the OCCHS staff who display COVID-19 symptoms, are sick, or do not feel well will not conduct an on-site inspection, which is common sense. How can you be sick and still go to daycares with children and staff, and that could infect them? It doesn't even matter if you have your mask on. So that's just common sense. OCCHS staff infected with COVID-19 virus will not conduct on-site inspections. Same thing, OCCHS staff will practice social distancing during the inspection, maintaining 3 feet of distance from staff, children, and other persons present at the facility to the extent feasible. So, this is just telling you, as an inspector, if you come into someone's home or you come into a daycare center, you still have to practice social distancing. This might be changing, I'm thinking soon, because if, the CDC has also updated their protocol, their safety protocol for C19. So we'll see how that goes. OCCHS staff will wear face coverings at the request of providers and when in classrooms or other indoor childcare areas where infants less than 6 months of age are present. So if the provider requires that you put a mask on as an inspector, as a state inspector, you have to put it on. No arguments, And if the provider says it doesn't matter, if you like, you put it on. If you like, you don't put it on. That's also gonna determine if the OCCHS staff will put the mask on. So OCCHS staff will practice good sanitary work habits such as frequent hand washing. And this is very important, as the state staff, moves from one part of the house to the other, as they're touching things, they do need to wash their hands, just like we do, just like the kids do, OCCH staff will end the inspection and leave the premises immediately if they begin feeling unwell. Childcare programs will be notified of a potential exposure to any positive COVID-19 case within 5 days after the on-site inspection date. So this is another very important thing. If the inspector comes and they find out, they find out they become positive with COVID, within 5 days after the on-site inspection, you have to notify them of the exposure. So those staff can notify parents and do what they need to do with precautions. Childcare programs are asked to notify the inspector of any positive COVID-19 case in the facility within 5 days after the on-site inspection date. So after the inspector comes, they check your daycare. You as daycare provider or as the daycare center director discovers, we just found a COVID case. You need to notify the inspector so that they can check themselves, test themselves as well. Inspection protocols have been updated to ensure that appropriate health and safety precautions have been implemented to minimize the spread of the virus. Virginia Department of Education continues to monitor statewide disease transmission, infection statistics, as well as guidance from the Virginia Department of Health, the Centers for Disease Control, and the Virginia Department of Labor and Industry regarding the precautions necessary to prevent the spread of COVID-19. Virginia Department of Education remains vigilant in protecting the health and safety of children, educators, providers, and our staff. Virginia Department of Education will continue to notify providers of any updated information or changes in COVID-19 guidance for childcare programs. I'm going to do a video of my recent inspection by the state, and I'm gonna give you a breakdown of what happened when she came in, when she went around, everything that happened. I'm gonna give you a breakdown. It was fun, it was exciting, it wasn't even stressful at all. My licensing specialist is amazing. I mean, if I have violations, it's okay, she's doing her job, all right. So programs should contact their assigned licensing inspector or the Office of Child Care, Health and Safety in their various regions, for more questions. So I hope this was useful to somebody, and stay tuned for more great stuff here. Bye.